and welcome to Module 5 of the Patient Compliance in Oral Care course. In this final session, you'll hear from your peer Sandra Lod de Menez, a hygienist from Gothenburg, Sweden, as she shows how the GPS approach comes to life in her practice. Let's dive into the real-world impact of behavioral change in action.
My name is Sandra Lod de Menez, and I am a dental hygienist with a doctoral degree in odontology. And currently I teach in the undergraduate dental hygienist program at the University of Gothenburg, while also practicing clinically at the Public Dental Service in Sweden. As part of my doctoral project, we conducted a field study, including 17 clinics and 30 dental hygienists. And these dental hygienists, they conducted treatments together with adolescents with poor oral hygiene, either according to conventional routines or using a person-centered theory-based approach.
Thank you for the kind introduction, Sandra. So, what was your initial approach to patient behavioral change before you started working with GPS?
You know, Martin, quite early in my career as a dental hygienist, I had the opportunity to take a postgraduate course focusing on oral health and theory-based behavioral interventions. But thinking back, as a newly graduated dental hygienist, I so truly wanted to help my patients, perhaps even save them from oral disease, instead of trying to empower the person to actually help themselves. And this approach often positioned the patient as a passive recipient of care rather than an active partner. And I found myself focusing more on the disease than on the actual person sitting in the dental chair next to me. And, you know, I tended to assume that oral health was the top priority for every patient, kind of overlooking the broader context of their life beyond the four walls of the dental office. And, you know, Martin, with the best of intentions, I frequently try to help my patient by setting goals for them and offering solutions, often delivering the same kind of standardized information about disease, believing that, you know, sharing all of my knowledge would be the key to behavioral change. And thinking back before I took the postgraduate course, I never used tools like planning or self-monitoring in behavioral interventions.
And now, knowing how you did it before, I would like to move on to your current experience with the GPS, and I would like to learn from you how you integrate the GPS into your daily practice. Do you have a specific example of a patient case where this GPS really made a difference?
Yes, I actually have one patient I want to share, a case I want to share with you. And, you know, as a newly graduated dental hygienist, I often met adolescents who, despite extensive preventive measures with information and instruction, did not have adequate oral health habits. And, you know, I found myself wondering what we as dental professionals are doing wrong. What was I doing wrong? And based on that, I would like to share a specific case, and that is an adolescent patient. And as it was not only beneficial for the patient, but it was actually a real eye-opener to me. It was the first time I applied an intervention that incorporated GPS and MI. So this was far before I was a doctoral student. And the patient was a 17-year-old male, and I met him for the first time during a routine examination. And I read in his digital records about some kind of difficult encounters with dental professionals through the years, and he had attended appointments for preventive care every 3 months for a very long time. And, nearly every time the dental professional had told him that he should brush his teeth twice a day, using the dental cleaning aids once a day, to rinse with fluoride once a day, and to change his dietary habits. And, throughout his childhood, he had very high caries activity due to poor oral hygiene habits and poor dietary habits, which had resulted in a lot of restorations and actually extraction of one permanent tooth due to caries. And when I saw him at the examination, he told me that he brushed his teeth 1 to 3 times a week and frequently consumed sweets and sugary drinks. And he had gingivitis, 100% bleeding, along with 2 new cavities. But otherwise, he had good overall health and attended high school. So I started off by exploring his needs, his knowledge, his oral hygiene habits, and this was followed by offering person-centered oral health education. And consequently, he decided to change behavior. And in this, I used scales to explore his willingness for change. And he actually chose to start with toothbrushing. And then we continued to discuss goals, and he set both short and long-term goals and developed a plan in written. And then I used scales to explore his self-efficacy beliefs. And I introduced a diary for self-monitoring. If I think back on the interviews that we conducted with adolescents, they expressed that the documented goals and planning made the treatment feel more serious and personal. They described it as similar to signing a contract in a positive way. It was a commitment. And they also shared that personal goal setting helped them to realize that a change of behavior would be for their own sake or their own benefit. They actually described the diary as an eye-opening tool, helping them to recognize, for instance, situations when they forgot to brush or situations where they are too tired to brush. And in that way, they also explored possible solutions to such barriers. The adolescents also shared that the diary helped them to track their own achievements, and that was something that was crucial for maintaining motivation throughout the behavioral change process and to set new and potentially higher goals.
Mm. And were there certain key turning points in this patient's progress?
Initially, I planned for like 4 to 5 visits, expecting to add different oral hygiene aids, possibly discussing dietary factors, but the patient wanted to focus all of his efforts on toothbrushing. So, using this approach, I realized that he was very mature when reflecting about his everyday life and his future. And he was highly aware of his poor oral health and actually deeply afraid of ending up like his father, who had very poor oral health and did not afford dental care and was actually missing a lot of teeth. And I noticed throughout the entire treatment that he had very high willingness for change, but lacked self efficacy. And he was very afraid of setting too ambitious goals and fail, because the experience from his childhood, the experience of dental care, was marked by failures. So it was very important for him, and I think this was one of the key turning points for him, was to set for him achievable and realistic goals, and to plan how to implement them in his everyday life. And by achieving behavioral change in small steps, I really think he was able to strengthen his self-efficacy over time. And during this treatment, I noticed that he had a change in his mindset. For example, by exploring the written diary and monitoring his progress, he had by himself identified times during the day when toothbrushing actually suited him the best. And he also changed from being this very insecure guy to actually solving his own problems. For example, he told me that he was worried about going back to old habits when he stayed at his girlfriend's house. But, before I even mentioned something, he continued on his own and solved it by saying, "But of course, I could just buy a toothbrush to keep at her place." And I believe that a second major turning point for him was actually the trust and relationship that we built. I truly think this approach made him feel heard, and the difficult encounters that I read about was not present in our appointments. So instead, actually, at the end of one appointment, he turned back in the doorway and said, "Thank you for listening." And that made a profound impact on me.
I can imagine. Thank you for sharing those experiences. And when we talk about the results and the impact of this progress and this specific patient case, what changes did you observe in the patient's behavior and attitude, and in the end also in his oral health?
Yeah, I believe I already kind of mentioned a potential shift in his attitude or mindset from this, difficult encounters to an adolescence openly discussing fears and future desires of good oral health. Significant behavioral change in this intervention was the increase in toothbrushing frequency. Initially, he brushed 1 to 3 times a week. And his first goal was to brush once a day to the next visit. But he came back and told me that he was not satisfied with his performance, so he wanted to maintain that goal to the next visit. And to the next visit, he had successfully achieved brushing once a day and was very, very proud of his progress. So then he set a new goal, and that was to brush twice a day for 3 times a week and once a day for the remaining days. And to the next visit, once again, he managed to achieve this. So then he aimed to brush twice a day, which he also accomplished. So by taking these small steps and setting for him achievable and realistic goals, that made him reach one of his long-term goals, which was to brush twice a day. But, Martin, if I may say from my professional point of view, my initial feeling was that his progress was slower than I had planned for. And my ambition was to add additional oral hygiene aids and, potentially discuss dietary habits quite early in the treatment, but I had to hold back. And that was an important realization for me. And Martin, just think about what he gained by being allowed to set focus solely on toothbrushing. He had never in his life established the habit of brushing twice a day. And as I said, that was something he set as his long-term goal. And this increased his self-efficacy, and I think this is a good foundation for future additional behavioral change interventions to promote oral health.
Yeah. Sounds like you mainly achieved these results by listening very well to your patients. It sounds like that was the key to success in this case. And maybe a nice follow-up question to that is, how did this GPS approach change your relationship with your patient?
Yeah, now we talk about change, but I actually never met him before, but I really felt that we built a strong relationship because he seemed to open up and trust me, which I believe came down to simply listening. And this approach makes the patient an active partner in treatment, and I think that he felt respected in our meetings. And if I may generalize, Martin, my experience is that using these types of intervention and this communicative approach significantly strengthen patient relationships. It fosters true partnership. And the adolescents that we interviewed as part of the field study, they actually expressed that a key factor in even initiating a behavioral change was that the dental hygienist took the time to explore their wonderings and their thoughts. And this made them feel acknowledged, and the information was then perceived as more personal than previously experienced in dentistry. It was about me and my teeth. And they also actually emphasized the importance of repeated visits during this initial phase of the intervention, as it helped to build this personal relationship. And they expressed that feedback from the dental hygienist helped them to keep up motivation during this behavioral change process. And encouraging statements from the dental hygienist carried more weight when this strong personal relationship had been built.
That sounds very interesting. And talking about the communication with your patient, how did this GPS approach and the motivational interviewing approach, how did it change the way you communicated with your patient to support them in driving change?
Yeah, I think the biggest change is that the patient talks more in our communication. And one might think that good communication is all about what I will say next or that I talk, but it is just as much about listening and to learn how to listen. And nowadays, instead of, providing a lot of information and providing solutions, I now explore the patient's needs and expectations, desires, and own solutions in order to tailor both treatment and communication. And now my focus is on eliciting the patient's desire for change and to make own decisions about behavioral change. And I guide them through this process rather than trying to push them towards a goal that was previously mostly set by me, I think. And you also mentioned support, Martin, and thinking back on the adolescents that we interviewed, they found it very challenging to maintain new oral hygiene habits without further support after the intervention, and they expressed a need for continued support or even reminders to prevent relapse into old habits. And but of course it is important to tailor support after each individual. And finally, if it's okay, I would like to share a moment that I had with a patient the other day, highlighting the importance of this collaborative approach in communication. And this was also a patient that I met for the first time, and she also turned around when she was about to leave and was looking quite funny at me. And I just have to look at the quote because I had to write it down. She said, "You were kind to me. You didn't point out my failures, but instead highlighted the small changes I managed to make, things I had really struggled with. And now I feel truly motivated to keep improving. In the past, I left dental appointments feeling so discouraged that I didn't have the energy or will to continue."
That must have been really nice to hear. That must have
Yes.
been a really nice experience. And talking about your own experience, your personal reflections, what surprised you the most about using the GPS?
I think really what surprised me the most was the improved relationship with patients. And I learn so much more about the person when using this approach, and the patients become more dedicated to treatment. It feels more personalized, and I also see better results. And I think what's also surprised me was the patients' reactions, because they often express, positive feedback, especially about feeling well cared for.
Hmm. And what advice would you give to other dental hygienists who are looking to start working with the GPS and trying to implement it into their daily care?
Yes, I want to say to my fellow colleagues out there that my advice is to be confident and trust the evidence supporting these interventions. In an economically driven organization, it is essential that we stay true to our profession and our competence and our responsibility. And I also want to highlight that implementing a new way of working can be challenging. We interviewed dental hygienists who implemented such an intervention in the field study, and the results emphasized that the dental hygienists themselves actually underwent a behavioral change, shifting from this disease-centered to person-centered approach, moving from being an individual expert to encouraging partnership. And that transition was described as challenging, but also a more enjoyable way of working compared to before. And one of these major changes that was challenging was actually to listen more and to talk less. And in the interviews, the dental hygienist described several key factors of importance when implementing such an intervention in daily praxis, such as having sufficient knowledge, but also have support from colleagues and from the clinic management, and a willingness for a personal change. And I just want to say to you, fellow colleagues out there, that don't give up when facing obstacles, because behavioral change is challenging for patients, and it can be a slow process with relapse along the way, but it can really lead to lasting changes and habits that improve both oral health but also overall health and well-being.
And thank you for these nice take-home messages to your colleagues. As a final reflection, how has the GPS changed your overall practice and your patient relationships?
Yeah, that's a big question, Martin, but I think applying a theory-based behavioral intervention, incorporating goal-setting planning and self-monitoring, and MI in patient communication has really improved my practice as a dental hygienist. And seeing patients succeed in their behavioral change really boosts my self-efficacy. And it is far more rewarding than delivering the same kind of lecture based on patient condition. And my relationship with patient has really strengthened, fostering trust and true partnership. And I think one of the biggest changes is the collaboration. Two experts meeting, one in dental care and one in their own life. And patients often express that they have experienced something else compared to previous visits in dental care, feeling more engaged and motivated and empowered.
Thanks for learning with us. This marks the end of Module 5 and the course. Take a moment to reflect and share your thoughts in the short survey on the Module 5 page.